a recent survey of New York City not-for-profit human services executive directors, 60% of respondents said they were having more difficulty managing their organization's cash flow this year compared to prior years, and over 10% were denied a line of credit. Late payments on both city and state government contracts exacerbate this problem, with requirements to begin service delivery as many as 8 to 10 months prior to actually receiving a signed contract and payment. What would you do to make a difference in both of those areas? Bill, we'll start with you.
Yeah, this really drives me personally kind of crazy when I see folks who are trying to protect others and then have to fight with the city government to get funding that they're eligible for. So I think the public advocate, again, the notion of the job is to find out what's not working and force the actual changes and results. It seems to me if we have nonprofit organizations that can't do their work because they don't have cash flow, and many that are actually threatened in terms of their survival, that becomes a priority for the city government to figure out case by case how to solve the problem. This harkens back to the point I made related to child care centers. The current policy of the city government literally risks the survival of child care centers all over the city. It is right and proper to want to fill every seat in every classroom. I agree. It is not right to hold back funding in a manner that may make it impossible for a center to remain whole and remain open. The answer, in my opinion, is to maximize all available funding and then provide the managerial support, and if necessary, to reform leadership structures and practices to make the center more efficient, improve enrollment, bring in other community partners. Look, there are some centers that can't make it because of problems of their own that are inherent. Maybe you partner with another organization. Sometimes that's happened, sometimes that hasn't happened sufficiently. So when I look at that situation, I think we're failing, bluntly. I think it's hit or miss. I think it becomes a public advocate's responsibility to say, where are the choke points that we can systematically break down so nonprofits get funding in an expeditious manner that they have coming to them? Where are the managerial problems we can help resolve? What types of support do you need to weather the storm, because we can't afford to lose you? I think that has to be the mindset, and it's not the mindset. I think the OMB mindset right now is the dominant reality of our city government. And sometimes it is convenient in OMB's eyes if nonprofits don't get their funding on a timely basis, and some of them don't make it, and there's one less thing they have to pay for, and that's unconscionable. I understand the mindset, but it's unconscionable. So it becomes the job of the public advocate to shine a light on that and work not only for the macro solutions, but case by case. I would see it as my responsibility to hear every particular instance where a nonprofit is not getting the funding it has due and go and intervene. And if the intervention behind the scenes didn't work, to be as public as possible. Again, I don't think the people of this city would like the notion of a nonprofit that's trying to help hungry people or trying to help children or seniors not getting the money it deserves, therefore being unable to provide the service. I think there would be outrage. I think that outrage could be brought together through community organizing. I think we could get media attention, and typically bureaucrats respond, and suddenly the red tape is cut through. That, to me, should be the consistent, imperative, consistent approach that the public advocate takes.
I've been there. I was the project director of MFYC services for most of Manhattan for 7 years. Was the project director, executive director of the New York Civil Liberties Union. I, for 20 years, was the treasurer of the Jackie Robinson Foundation, and currently the treasurer and board member of the Amadou Diallo Foundation. In those positions, especially the MFY position, we got funding for programs such as the one that I talked about before of taking people from public assistance and putting on social security disability. For every dollar the city gave, we saved $5. But funding was a real problem. We got funding for citywide mental health services dealing with homeless people and mental health in general, and the cash flow problem was always a problem that I had to face, and it hurt our effectiveness. The Jackie Robinson Foundation, we were able recently to get a line of credit, which some groups don't. What a public advocate's office should do, when I was talking before about being linked up with all of you, the civil libertarians, I don't want to use the word, but we have a dossier on each one of you, because that is due would be important so that you would have an advocate and ally in making sure, A, that you got your funding on time, and B, maybe even get some additional funding. We'd have a person in our office who would be exclusively working with the not-for-profits, because the not-for-profits expand exactly the vision that I have for the Public Advocate's Office. And when and if there are government red tape, you got to take it on. And that's what an advocate does. Recently I was talking to a guy in the Bronx. He owns a pharmacy. He provides a lot of the medication for the HIV patients. We're having a meeting next week with a group of those people because the funding is being cut with regard to how much they're going to be able to get in the Medicaid program and hospitals having problems with, et cetera. And he's telling me how long it takes before the reimbursement. Well, that should be changed. And how do you change it? You change it by advocacy. What does that mean? One, the letter to find out whether or not the bureaucracy can be more efficient. Two, if that doesn't work, perhaps legislation specifically requiring maybe 20 days after reimbursement, 20 days after someone gets a grant. And finally, if that doesn't work, my favorite person lately, Clint Eastwood, and isn't it remarkable how good this guy has gotten as he's gotten older? And he has that line, "Make my day." So if in fact this problem continued to exist and it didn't work in the other methods that I suggested, then what do? I sue the rascals and try to get a court order enjoining them and requiring them in a mandamus action to make the payments in a set period of time, because otherwise the effectiveness of the program doesn't work. People say, well, maybe that's too radical. Well, sometimes you have to do this because it's a life and death situation. You do it once and you win, and everyone else falls in